Hey guys, welcome back to our training. We are going to do a live training here on Sunfire Matrix, which is our quote and enrollment tool. So let me just get logged in here and we're going to get started. All righty. So the first page that you will see is your dashboard. So in the top right corner, you'll see, and also you'll see that you're on the home button. Okay. On the right-hand side, in the last 30 days, you would see how many people you have enrolled. You could even click on it, and then any incomplete applications, you would also be able to click on those. And it'll then show you eventually where those incomplete ones are. Okay. So just to kind of go back to the main page, now down here are all the clients that you have enrolled within the last 30 days. But if you ever need to find a client, for instance, we looked in the other video for Miss Bell, right? So she's located right here. So if I need to go in and do an adjustment, I can immediately go. I can even look at the enrollment application, okay, that we did for her when she initially enrolled into the plan. Okay, so here we can see what plan we enrolled her into, all of her information, primary care physician's information, all that good stuff, Medicare ID number, what election period we used for her, and she just got Medicaid, so that's why we had used that along with our information down here. Okay, excuse me. So that would be one thing if you have any follow-up questions, etc. Now, let's hypothetically speaking, say you want to look up a plan for, if you just want to do a quick research and you're not on the phone with a client, or one of your customers has a question and you can't locate them in here, or you have enrolled them in through United Healthcare, you can always come in here to do a quick, hey Kevin, how much dental do I get? I have a profile set up. I call this the dummy profile under my name. You would put in the top right corner, right? Now you're under the individual profile. You would put in the zip code that you're looking for, okay? And then you would go all the way to the bottom, okay? To then do the plan selection. But I'm going to take it a step back and going to create a new profile with you all. So again, we're going to click on the home button. And then if you don't see the option here to look for a new plan, you can always go here and you see that there is the option to add a new contact. Okay, so in this case, we're just going to make up a new profile. Okay. All right. And then, I don't know, zip code. All right. Now, again, if you're doing an email signature, you can put the email in here. I only fill out usually this section. I don't fill out this section quite yet because, again, this would also go into the application. I manually type in the phone number for signature reasons. Okay. Now I want to do the next thing. I want to save, but at the same time, go to the quoting tool. Okay. So I hit save and quote. All right. And then please select the types of this that you want to discuss with the client. So this is really, really important, guys. The first one is for Medicare Advantage and Medicare Advantage prescription drug plans. Okay. So any MA or MAPD, you would hit the checkbox right here. If you're just looking for a prescription drug plan, then you would want to hit the second one. If you're looking for and let me just correct that, any Medicare Advantage prescription drug plan is here. Any Medicare Advantage plan, meaning a plan without drugs, is actually down here. So if you do a veteran, for example, without drugs, you would actually click the Medicare Advantage icon. And then if you have anybody with a DSNP, a dual special needs plan, or a chronic special needs plan, you would have to click here in order for those to appear for you. Okay. Now, the next one is, are you taking any prescription medications? Most people do. If you click yes, it'll open a little box that you can actually add the pharmacy and medications. Okay. Now, here at the top, now, Ms. Jones, where do you get your medications usually from? Now, a lot of carriers have their own pharmacy, or a lot of carriers offer the option to mail them the medication, right? Some members enjoy that. Some members don't like that at all because people still in the neighborhood, for example. So, but the key point here is that you play around with the pharmacies a little bit to see if you can lower the price. If they currently go to Kroger, Walmart, you name it, maybe check on a couple others by just typing in here CVS, for example. Okay, and then you leave that there. And then Ms. Jones, now, what are the names of your medications, the dosage, and how often a day do you take them? Those are the three pieces of information you need. Name of the medication, the dosage, 5 milligram, and I take it twice a day. All right. The name of the medication is amlodipine, for instance. Okay. Now, Ms. Jones, does it have the HCl behind it, or is it just amlodipine bacillate? Okay. Okay, great. Now, do you take, how many milligram do you take? All right, 5. And then how many do you take a month? Oh, I take 2 a day. Oh, okay, so that's 60 a month. Wonderful. And then you want to hit add that medication. You want to add another one? Okay. Hydrochlorothiazide. Okay, wonderful. And what's the dosage? And you take 1 a day? Wonderful. Okay, and so on and so forth. You can edit the dosage amount. So if you need to change a different, oh no, it's 50. Okay, wonderful. You can also remove by deleting them. Okay. All right. Then once you've completed this section, you just click done. All right, and then you'll see your medications listed. Once I'm done, I always copy this section here and I put it in the Google Calendar in the comment section, because if for whatever reason the system goes down and I need access to my client's medications, I want to have access to it, okay? And if they call and say, hey, did I tell you about X, Y, and Z medication and I'm at the grocery store, I still am able to access my Google Calendar on my cell phone, and I'm able to say, yep, I see, I'll add that medication to your stuff, okay? Now, the next option here is what's important to you. You don't have to ask these questions, guys, or you don't have to fill this out, but it is important that you, in your script, you'll see where I have the script prepared for you guys, where I'll actually kind of include those questions. Now, Ms. Jones, what's important to you? Do you need to get dental work done? Do you wear glasses, right? Or do you utilize the over-the-counter benefits? This is an opportunity for you to kind of find information that you can use to build a case later on, where currently on your plan, you get $2,000 in dental, Ms. Jones, and this plan gets you $3,000, and you're trying to get dentures. So therefore, we should put you on a plan. I would recommend this plan because you get $1,000 more. You're on a fixed income, right? So every dollar counts. Wouldn't you agree? Okay, wonderful. Are there any doctors that are important to you that you like to be covered? So I mentioned in an earlier video that I don't use this tool because it's not very accurate. If you choose to for free, but don't count on it, okay? And then, are you currently enrolled in a Medicare Advantage prescription drug plan? You can answer that if you like, but it is not required. Anything that's not required, I don't fill out. How often do you see your doctors, or do you receive medical care in a year? The reason I don't fill these things out, guys, it's not going to make a difference of the plans coming up, okay? The things that I'm showing you that you do need to fill out, they do make a difference. So these things are kind of optional because they don't affect them showing us different kind of. And then I was talking in another video earlier saying where it asked, do you receive extra help / low income subsidy? It is optional, but it's very important that you fill that out and don't get confused, because that will change the monthly premium payment of the medications, as well as it can change if the plan has a premium payment, it can change that premium payment, okay? Now, remember, if you're not sure if somebody has LIS, you can use the Jarvis, which is United Healthcare Medicare eligibility lookup tool. I created a video on that if you are not sure how it works, and that will show you what the client has, okay? And there's also another video that tells you based on what amount they have, which one to click, okay? So I'm going to select this one. Is usually for full Medicaid members, okay? There's LIS and then there's Medicaid. Anyone with Medicaid has automatically LIS, but anyone with LIS does not automatically have Medicaid. Don't worry, I will actually go into detail in another video about that, okay? And then the final stage is view all plans, right? Now you are actually viewing all plans. You want to make sure that you have the correct zip code in, okay? And then up here, you can still change the pharmacy medications. If you wanted to do doctors, you could do that here. this means you don't have a current plan selected. So in here, if you would have said yes to the question that you currently are involved into a plan, it allows you to actually look up a plan, okay? I don't like the way they listed here. It's hard to find it, so I'm not going to choose a plan here. So that's why I always leave it blank. Feel free to use it if you like to. Now, if the client has just Medicare, right? Medicare Advantage plan, then we're here. Just a prescription drug plan, we're here. Just a Medicare Advantage plan without drugs here. Special needs plans for dual, chronic and dual plans right here, okay? On the left-hand side, you can filter the plans if you like to. The only filter option that I use is the Part B give back option. I have not seen that any of these others will populate a specific plan, and maybe there have been any changes. Let's try it. Because most plans have dental, okay? Like 90% of the plans have dental coverage. All right. Now, the reason why we use the Part B give back, what that means is the client would get a monthly amount back on their Part B. So if you look over here, those are the 3 recommended plans available in the client's area. You do want to quickly go down here. If they're saying they have a plan that you don't see, it might be you're not appointed with that plan, meaning it wouldn't show, okay? But here, there's only the 3 plans available. And then what is the give back amount? Here is where you see how much they would get back on a monthly basis, okay? 65, 50, and then WellCare is going to be $70. So out of those 3, you see that WellCare has the most amount in give back. So if somebody's currently on this plan, you can definitely say, hey, I commend you for being on the $50 give back. That is a really good plan. But Ms. Jones, do you mind if I suggest something? There's a couple of things that I want to point out to you. So for one, I have a plan, or I see there's a plan available in your zip code that will give you $70 back. But I also see that currently you are paying $60 a year for the 2 medications that you're on, whereas with WellCare, on the give back plan, you would not spend $60 a year on your medication. It would be $0, okay? So not only would you get $240 more a year, you would also save $60. So that is basically $300 a year that I can save you, okay? And I know it went kind of fast, but basically, here's the name of the plan, okay? On the right-hand side is the star rating, and then at the top is where you see the plan ID number. Okay, you always want to write that one down. I don't copy it from here. I go into the detail of the plan, which I click here. Okay. Now, if somebody is wanting lower co-payments, you can always click on the benefits section, because then it will show you what the co-payment is. If somebody is a stickler and said, I'm only going to change if I get a lower co-pay, then that would be the case. Okay. Otherwise, we leave it on cost so that we can see what is the annual cost. It would actually summarize if the premium plan, if there would be a premium plan, and if the medication would cost something, it would give you the total for both together. Okay. So what you see on the side is really the annual expense. All right. Now, let's say, for instance, I want to compare those 3 plans. As you guys see at the bottom here, currently there is nothing selected. And if I am selecting or hitting the compare tool, now we have this plan that populates here, okay? You can do up to 3, as I mentioned before, which is perfect in this scenario. So now we have all 3 plans, and we can hit the compare button right here. And this will populate a new page. Okay, excuse me. All right, now this new page that you'll see, plan number 1 that you selected, which is the Aetna Medicare Plus PPO plan. You have the Humana Choice PPO plan, and then you have an HMO plan. Remember, HMO plans are more benefit rich. However, those plans are, if you're within, you can think of, if you draw a circle on a piece of paper, right? You can only see the doctors within that network. If you want to see a doctor outside of that network, you have to go to your primary care physician and ask for a referral to go to an outside doctor. Whereas on a PPO plan, they're a little bit less beneficial. However, you can go in and out of network and you do not need a referral. Okay. So the way you would want to look at, guys, is basically downstream if you're looking at each individual company. Okay. Now, when you compare, you want to look line by line. and basically monthly premium payment. All right, Ms. Jones, all three plans have a $0 monthly premium plan. Okay. And I have on our presentation, so basically on the script, you will say, now, Ms. Jones, on the Aetna Medicare Advantage Plus PPO plan with the ID number, your monthly premium payment is. On the Humana plan with the ID number, on the WellCare plan. All right. The next thing that we will look at, and I'm not saying that this information here is not important, it certainly is, and oftentimes you can even use it to your benefit. But the main categories, so to say, that we do look and compare here are, because you don't want to overwhelm the client, is the monthly premium payment, the dental services, how much coverage is included on the plan. This one, for example, has no coverage, meaning it doesn't have any allowance, I should rather say. This one has a $500 maximum benefit for preventative and comprehensive dental care combined. And then it says, see evidence of coverage for details. One thing that you want to remember is, Aetna, anything with Aetna, you as the customer prepay and they reimburse you. All the other carriers, if I'm not mistaken, usually all of them that I know of, they will actually pay whatever they're saying here. They don't reimburse you. They pay their portion. Okay. So Humana's give back plan does not have a dental plan included. Okay. So what that means is the co-payment for Medicare covered, which prior authorization is required, is $50, but there's no allowance. Okay. And then with WellCare, the dental benefits on this plan include coverage for preventative and comprehensive care up to $1,000, including but not limited to cleanings, x-rays, oral exams, fluoride treatments, fillings, dentures, bridges, crowns, root canals. But here you go, with a 40% member cost share comprehensive and a $0 copay for the preventative services. Okay. So what you don't want, if a member tells you they need dental work done, is anything that shows you a percentage. Okay. It's not good. For example, I had a hernia surgery, I think a couple of years ago, and I had health insurance. I have health insurance through United Healthcare, and there was a co-insurance. I called the doctor before the surgery to find out what is my expense. And the one thing that I wasn't made aware of, or that I couldn't remember talking about, was the co-insurance after the co-payment. The co-payment was about $6,000, right? And then my co-insurance was another, I don't know, 20, 30, 40%, but it was a $20,000 surgery. So it was a super unexpected bill that I had to face. Thank God I work in the insurance industry and we live in abundance, so I was able to pay that. But I'm saying that to say, when you see percentages, and that's a great thing to look at if somebody's currently on a plan, yes, you get $1,000, but are you aware that you have a 40% co-payment? I'm sorry, co-insurance with that plan. And a lot of agents don't go over the details because that would make people not go with it. If you're just looking straight across, wow, $1,000, you get $1,000, that's great. Yeah, but look at the fine print. And that's why it's important when you do have a member on the phone and they already think they're in the best plan, that you just do a quick summary review of their plan and compare it to a couple of others, that they're fully aware. Again, we're educating, okay? If somebody does have diabetes, you definitely want to look at the diabetes supplies. Otherwise, you just move on. The next main icon would be doctor's office visits, okay? And then right underneath you have specialists. So currently on your plan X, Y, and Z, you're paying $10 for in-network, $30 for out-of-network. With Humana, you would be paying $20, whereas with WellCare, you would be paying $10. Then you go to do the same for specialist, okay? In-network, out-of-network. And then the next thing that I look over, I don't personally discuss hearing unless they ask for hearing or that comes up in the discussion. The next thing I go over is over-the-counter benefits. And I think I passed it, but it's very likely that the give back plan doesn't have any. That's why it's not showing. Yep. All right. So under O, the next thing you would see is over-the-counter benefits. Okay. In this case, it's not up. So I'm going to move on and we're going to look at vision benefits. All right. Now you'd say the same thing again on the Aetna plan ID number, you get $250 a year. With Humana, you would get $100, as well as with WellCare, you would get $100. Okay. And then the last but not least thing that's important that you look at is the inpatient hospital stay coverage. Okay. So basically, on the Aetna plan for day 1 through day 4, each day for the first 4 days, the client would pay $450 per day if they get into the hospital. After that, day 5 through day 90 is going to be covered, but there is a 40% per stay out of network if they go out of network. Okay. Same amount here, as you can see with Humana, okay, and apparently it's the same amount for the same days with WellCare as well. So very often that varies or that's different. Um, so you just want to make sure that you look at that because that could also be a selling point. Right now, Ms. Jones, do you know that if you get into a hospital, you actually will have to pay $250 a night, $450 a night, whereas this plan, you only pay $95, right? So see whatever you can use against to build a case. And then if you scroll all the way down to the bottom, you clearly have the nursing facilities and things of that nature. But if you scroll all the way down to the bottom, you will actually then see the summary of benefits, evidence of coverage, star rating, and apparently they're adding Spanish here to it, which is great. So if you click on the summary of benefits, it's a PDF document that comes up. And as I mentioned in an earlier presentation, you can just do control find, right, for that. And if you want to see how much dental it has included, you can kind of tap here. It has the word dental comes up 4 times, right? This is a, I think 12-page document here, but we see already here, what is the exam cost? And then we say here, our plan pays up to $500 a year. Cosmetic procedures such as teeth whitening are not covered, okay? You are responsible for any cost over this amount. This is a PPO, da, 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 da. Okay, so here's where you kind of would find that information. Okay. Now let's say, for instance, well, I was going to put in x-rays. So here you would see if they say, well, how much does it cost to get x-rays? Here you would see that information. Okay. All right. So I think that's good enough as it pertains to that. Now I'm going to scroll all the way back up and I'm just going to remind you again, write it down. It is the monthly premium payment. Okay. You do want to look at if somebody takes a lot of medications, what is it? And I'll do a detailed training on how we look up that kind of stuff, but I don't want to overwhelm you with information. So I'm just giving you nugget by nugget. Okay. The next thing would be, we want to take a look at the dental services. From there, you're going to go to doctors, primary and specialists, the copays, okay? From there, you will go to over-the-counter benefits, which we don't have here, but they would be in this section. And then from over-the-counter benefits, I personally go to vision benefits because a lot of people wear eyeglasses. And last but not least, then to the inpatient care, okay? Scrolling all the way back up, guys, you see there's another tab called drug cost details. So you heard me talk about the different kind of options where I was talking about tier levels, okay? Tier levels are basically categories, you could see them as, and as to which category the client's medication fall in, okay? So we again have all 3 plans listed here. And I've mentioned to you earlier that with Aetna as well as WellCare, using the current pharmacy that we had selected for the client, the medication cost would be $0. Okay. Now, here you will see the tier level. I personally prefer to scroll down and look at it by month because you will learn later on there's 4 different coverage stages where the medication cost could be a different price. Okay. Now, as you can see here, you'll find the detailed estimated cost and then the monthly. So basically, with Humana, this medication costs $2 and $2.90, which equals $4.90, right? So there will be a monthly expense of $5. 5 times 12 is 60. Now we know where that's coming from. I always recommend you to check almost each month. Clearly, because we know how to do math, 5 times 12 is 60. There's no difference in here. But if you have a lot of medications and the price, you can just quickly come up with it, right? If there's larger amounts. I recommend that you look in here because there is different coverage stages. And so you want to make sure that the client is not facing a higher charge at some point and you told them a different amount. Okay. Now, if the medication is not covered in any tier, it wouldn't have a tier number in here. Tier 1, remember, is the lowest tier. Tier 5 is the highest, okay? So the higher the tier, the more brand specific the medication, the more expensive usually the medication, okay? All right, so I am going back to basically the page where we selected those 3 plans. If I'm unselecting those, okay, I can also unselect those 3 plans. And we could now look at dual special needs plans, okay? Now, I recommend, because in certain areas, if there are larger metro areas, I recommend if you know, and I created a cheat sheet for us to know in what areas in certain states, not in all states, in like 4 or 5 states that we mainly work, I created a cheat sheet that would allow you to know what plans give you what, okay? So in Georgia, for example, if I have a client that needs something in Georgia, for instance, and they tell me what they need, I usually shoot for those 3 carriers, okay? Depending on what company they're currently with, I already, and what plan they're on, I know by heart in a few states what better plan, if there is one, which one that is, and what the reason for it is, okay? Right now, most of our beneficiaries are after the food card benefit, but the prices are increasing. It makes totally sense, right? So let's say, hypothetically speaking, somebody is on this dual special needs plan, okay? So this dual special needs plan is a PPO with Humana, okay? Then we have another PPO plan, which is another dual special needs. And I'm going to take out those full quick so that I can only see Humana plans for now, okay? And then here is the third dual special needs plan that's available in Georgia for DSNP clients. They do have one chronic plan. You see PPO CSNP, that would be a chronic plan, okay? I don't think the chronic plan offers the food card, but I might be wrong. But let's focus on those 3, okay? So I want to compare those 3 to see, let's say we have a client that has QMB, Qualified Medicaid Beneficiary, okay? So they have basically full Medicaid. I want to determine which of these plans gives them the most benefits, okay? Now, remember, besides the benefits, we always have to make sure that the doctors also accept them, okay? Because of my knowledge here, I know that this is basically the lowest paying food card plan. This plan currently gives a $25 food card. This plan gives a $50 food card, and this one gives a $75 food card, okay? So, and it's the same with the benefits, lowest benefits, middle, and the best benefits overall. But remember, this is an HMO. If you have a client on 15 medications and going to all kinds of specialists, the HMO might not be their best interest because they're going to call you in 3 weeks or call somebody else or get called and get switched back to a different plan and they're no longer your client. So it's really important that you specify to the client and explain what an HMO plan is and if they're okay with that, okay? Otherwise, yes, it's great benefits, but it's going to defeat the purpose because the client is not going to stay on that plan for long. All right. Now, how do you find the food card benefits? They are not on this page. So you scroll all the way down, okay? And I'm just going to select the one with the highest for now. I'm going back to the summary of benefits. And with Humana, I'm just going to search for food, okay? Whereas with WellCare, for instance, you search for something else, and I'll show you that in another video. All right. So the Humana's food card is called the Healthy Foods Card, as you can see right here. And it does show you there is a $75 automatically loaded every month to spend at particular retail stores on it, okay? So now I know the client gets $75, okay? Now I'm going to scroll all the way up for you because we need to see what level of Medicaid do I need to have to qualify, okay? Here are all the counties that this plan is available in, okay? So if I scroll down just a little bit more, I will soon see an option that says to be eligible with Humana, okay? It varies by carrier. To be eligible for this plan, to enroll in the Humana Gold Plus 003 HMO DSNP, you must be entitled to Medicare Part A and B. You must live in the service area and receive certain levels of assistance of Georgia Community Health Plan, which is Medicaid. If you receive both A and B, you're eligible for the dual, if you receive both of those, okay? Now, you may enroll into the plan if you either have QMB, QMB plus, and the plus is usually a plus sign, SLMB plus, or FBD, okay? There is a video that explains the different levels of Medicaid. I do want to call out here, be careful when you have that SLMB plus. If you put them on there and they just have SLMB and this is a requirement, they're not going to qualify for that plan. Okay. Now, if you do check that they have that, remember you can check on Humana's website by the eligibility lookup tool. You can check Jarvis. You can even call into the cares, or you use United Healthcare's chat to find out what level of Medicaid they have. Okay. And that's how you would find out. Anything else? You can always do control find. It's the easiest way to find something in the summary of benefits. Okay. If you can't locate it in here, it might be helpful if you look at the evidence of coverage. Wonderful, which would be here. And the evidence of coverage is just a little bit more detailed than the summary of benefits. So as you can see, it has 240 pages. So if I'm looking at food, I will very likely, so this one has the $50 healthy foods card, okay? And then there's, I don't know why there's so many, but basically we could click through all of that. What we want to know is how much do they get, okay? Now this is with Humana. If the client agrees, this is the best plan, we would want to enroll them into this plan, okay? Now, if somebody only has partial Medicaid, which is like SLMB, for example, so I just want to show you this real quick. You do not qualify for the left and right plan. You would only qualify for the middle plan. The way you find that out is if you, well, we just saw it. If somebody has SLMB or QI, which are the two lowest level of Medicaid, right? Then they wouldn't qualify for those two plans because you saw the lowest that you have to have is SLMB plus. So here you're eligible if you have QI, QMB, QMB plus, SLMB by itself, SLMB plus, and FBD. So basically all levels of Medicaid qualify for this, okay? And that is the $25 food card, okay? As you can see right here, it gives a $25 food card, all right? Now, that is basically, those are the details as to how to look up the food card with Humana. The food card with WellCare, guys, look, we looked that up a little bit different. Again, the scenario is the same as far as comparing them and then looking at the summary of benefits. But with WellCare, depending on the state, South Carolina, for example, doesn't have a food card. And then the other plans mostly have like a $50 food card. And one thing that I want to point out with WellCare, it's a grocery delivery service. So you do not go to the grocery store. You go on an app called Shipt. I personally use that app, have been for 2 years. It works great for me. But if you have people that are older and you have a client that got just switched from your Humana plan to, for instance, a plan with WellCare because they give you a food card, a great case that you can build is saying, now, Ms. Jones, are you aware, or are you like my mom or my grandma and you don't like actually for somebody else to pick your fruits and vegetables, right? Because you don't know what they pick. You're kind of funny about that, right? You have to see what the client is about, but that's an easy way to get the client back on the books, right? So by saying that, like, remember with Humanity, we're able to go to the grocery store yourself, or then some people that are bedridden or don't really have a car, this might be a better solution for them to have the groceries delivered. So active listening is so important. The way you look it up here is SSB. Okay, so you type SSBB if it wants to work. Okay, SSB. And that's basically the section here that will tell you what the grocery delivery is. Okay, so you could also type in grocery delivery. I always use this because this is the section where all the information comes up. And here you see that it offers a $50 a month. It's a little tricky. We only looked up one plan. It came up, we looked up the Liberty, which is the highest level. If you don't have FBDE, you do not qualify it. But as you can see, there's two plans. So we scroll up a little bit. This is the Liberty, and then this is the dual access, okay? They both offer $50. As of right now, there's only WellCare that offers the Flex card, okay? Well, there might be, I think, there might be one other company that offers some sort of a Flex card, okay, in one state or two. But overall, WellCare is the main carrier that offers currently the Flex card. It'll probably change. And the Flex card is a debit card for dental, vision, and hearing benefits. So you can think about a debit card that they can use on top of the benefits that they're currently getting, okay? And then there's a utility Flex card, which you see on this plan, says utility Flex card. Each month, the client gets an additional $50 to pay utility bills, okay? Electricity, your phone bill, internet bill, things of that nature, okay? And then there is a robotic companion if you want that. I don't know, but that's clearly up to the client. You see there's a flex card for $1,500 that will help with dental, vision, and hearing. So if you're unsure, you can always come in here. And then also they get up to 24 visits for in-home healthcare, okay? Or it's like some sort of chores or support system within the house, okay? So, but remember on the Liberty, you have to have FBDE, otherwise the plan will not be approved, okay? So that, and then our third carrier that we use all the time would be United Healthcare, guys. So if you click on United Healthcare, you see quite a few come up. I'm just going to select one because it's the same everywhere again. So this is the HMO, and with United Healthcare, they do things a little bit different as it pertains to the food card. The food card and the over-the-counter benefits are connected. So you basically get an allowance, as you can see, $100 a month for both of them together. For food or over-the-counter, you can split it, spend it however you want to. You get one debit card. United Healthcare does allow you to go to the CVS store. They have a specific booklet with over-the-counter benefits. There's like vitamins, toiletries, things of that nature, and it allows you basically to purchase those where you have $100 allowance, okay? If you spent $100 a month on over-the-counter, clearly you have nothing left for your food card benefits, okay? You can go on the summary of benefits, but I like that basically whatever you see here on the dual special need plans will give you a clue what the food card will be. We can also double check here if you're ever unfamiliar or unsure. All right, so the food card benefits, we don't want the foot. All right, so the food card is $100, okay, on a monthly basis. Now that is only with United Healthcare, and that's only on United Healthcare dual plan. So don't come on regular MAPD and look at over-the-counter benefits and say, oh, you get da 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 da. And then very specifically, please be sure that you look here if it says every month or every 3 months, because in general, over-the-counter benefits are paid with a quarterly budget. So just know that it's once a quarter and not every month, okay? Wonderful. Awesome, guys. Let me just take a quick look if there's anything else that we need to cover. We covered the Part B give back plan. We covered the regular Medicare Advantage plan. Again, the only time you want to look at a Medicare Advantage plan without drugs is usually if you help veterans that do go to the VA and don't see any other doctors. On the left-hand side, there's really not that much to it. I don't select anything here besides, as I mentioned earlier, if you're in an area where there's a lot of plans, you do want to click on, for example, the couple of carriers, because if you look at it right now, there's so many plans, it's kind of overwhelming to see, right? And then that's really it. If you're ready to make the enrollment because the client made the decision, you do see the option here. If you just want to look at one plan by itself, you can always click on the details and it shows you the information here. And so if you're ready to make the enrollment, it'll lead you to the enrollment page. You make sure that you complete this information here, okay? You do not have to put in an email. You do have to put in an address, city, state, otherwise it gives you a red. If the mailing address is the same, you will not change it. And then also, guys, you cannot, if you, like, for instance, I had an empty space behind this, it will give me a little flag red and it will not allow me to complete the application, okay? So you complete this, you go to the next page, and then as you guys can see, so here I need to select the gender. Ms. Sean is not married. We are in Atlanta. Let's see here. 1, 2, 3. I just want to show you guys here real quick. It didn't take the address that I put in, so let me just see if that will do it. And you hit continue, okay? Next thing it'll ask you for the client's first and last name, the Medicare ID number, exactly how it appears on there, Part A and Part B start date. If the client currently has a provider, the provider's name and the provider's ID. Remember, you can simply Google Dr. Willie Smith, NPI, Georgia. If the client is actually already there, yes. And then down here, you usually put whatever the preferred language is and then large print, okay? And I can't go to the next step because it won't let me, but that will be the final page. You review the information, which is what the client will see. And at the bottom, you would then actually, give me a second. I will do this here for you so that you can see what I'm talking about. All right, so all right, so we're going to use Miss Heather. Another thing, if you use a different zip code up there and now you want to enroll them into a different plan, it in another state, it's not going to work. Okay, it's going to give you an error message. All right, so we have Miss Heather's information pre-populated. Okay, we don't care about the address right now. I'm just going to put in 123. She is in Simi, Florida. No. And see here, I'm missing that. So I just continue, fix that quickly. Okay. I like to copy the first and last name based on how they filled it out on the lead card. But you always want to make sure that that is the correct name, because sometimes it's Joe, but really their name is Jonathan or whatever, right? Or Joseph, you name it. 11/1/2017. And then remember, her part B was a different date. All right, I'm just gonna say no, she doesn't have a doctor, just to kind of show you guys and get through this. And then continue will be the final page, okay? So the final page will allow you to select, again, do you have Medicare and Medicaid, and you make a one-time selection during OEP. But I'm sorry, this is actually the one, but you haven't had a change. So if you have LIS, you can use this SEP, okay? And then there's a whole bunch of them that you can use, 5-star rating, etc. I have a document that will list all of those, okay? And then some have TRICARE, no. Does your spouse work? No. Other than Medicare and Medicaid, do you have anything else? Are you currently in a nursing home? No. Now, do you have Medicaid? Yes, and this is where you would put in the Medicaid ID number. Otherwise, this won't get approved, okay? And then Ms. Jones, how would you want, there is no monthly premium payment, as you can see right here, but they still ask for a payment method. We always select the Social Security check, and we continue, all right? Ms. Jones, and this is what they see once they put in the code, okay? So that's when you ask them to just double check that everything looks right. All right, great. You must read the disclosure, okay? So you basically read that disclosure to them. If you're emailing it over, they can read that themselves. They would hit the I acknowledge button the same way as you're hitting it. You want to select the enrollee. And then if you're emailing, you use e-signature, you would just put in the, I'm sorry, this is if the customer is present. It clearly states that here, right? For some reason, the e-signature threw me off. This is if you're emailing or texting the client. If you're emailing, you have to put in an email address. If you're texting, you have to put in a phone number, okay? And we'll do a live training session what it looks on the other side, but really you submit it, and then the client will receive the text message that I showed you in the other video. They will put in the security code that the system, the one-time code that the system generates right here. They put it in, they put in the name and the information. Then they will be able to see this page, okay? They click the I acknowledge button after they read it. And then right here, there will be a signature box for them. Like it looks like as if we're signing on the screen. So it looks like, Ms. Jones, right under the beneficiary or authorized representative, do you see the signature box? Cool. Type in your first name and last name, okay? Date. And then they would just hit the submit button, okay? And that's really it. You will then get a notification here on the screen where it says enrollee signed signature, something similar to that. And that will complete your application, okay? Awesome sauce, guys. We're going to end this video here. If you have any questions, as always, feel free to ask, send me an email, schedule a quick call, and I'd be happy to go over that or review that with you all. Until then, have a good day.